Hello, everyone. We'd like to welcome you to the GSSA Applying to Residency Series Ophthalmology webinar. My name is Kristen. I'm a GSSA VP of Advocacy, and I'm a medical student at Mayo. I'll be moderating the webinar today. So we are very fortunate to have two wonderful panelists with us, Dr. Mike Murri and Dr. Otana Jakpour. We will begin by asking the panelists a set of questions about applying to residency, and then we'll move into questions that have been submitted by the registrants, either through the feedback forms or questions you can submit by the Q&A button or the chat panel at the bottom. So everyone except for the panelists will be muted and the videos will be off, but we will be recording the session. And you're welcome to submit questions again through the chat. So I'd like to begin by introducing the panelists. Dr. Mike Murri attended the medical school at the Baylor College of Medicine and is currently a second-year ophthalmology resident at the University of Utah. Dr. Murri's interests include optimizing cataract and refractive surgery, global ophthalmology outreach, and outreach residency curriculum, complex anterior surgery, segment surgery, and medical device translational research. Dr. Jakpour is a recent graduate of Harvard Medical School and is currently a first-year ophthalmology resident at the University of Michigan. Dr. Jakpour is an active member of the Executive Board of Residents and Fellows for Global Health Equity at Michigan Medicine and has extensive training in global health, including a Master's of Science in Epidemiology from the London School of Hygiene and Tropical Medicine. So Dr. Murri and Dr. Jakpour, we'd like to invite you to talk about your global surgery experience, background in medical school, and what your involvement looks like now as a resident. Dr. Murri, would you like to start?
Sure. So as for my kind of global experience, it started when I was quite young. My dad's an international accountant, and so I lived in Ecuador for 4 years when I was young. And then spent some time living in Sweden for a couple of years and kind of being around the world. I ended up going back to Ecuador a couple of times, both in high school and in my undergrad, not necessarily doing ophthalmology things, but going back to do global health work, to work in an underserved hospital there. And then I did like a whole summer there, kind of like an externship as well. Definitely got the bug really hard. I think that one of the reasons why I picked to go into medicine was definitely that connection and that realization that I could give back through global health work. I ended up getting into Baylor College of Medicine, and while I was there, I did kind of a global health track and got more hooked on it. Worked with refugees there in medical school, refugees kind of like in Burma, and from kind of like the Thailand area that were living in Houston. And then I was able to do, earlier this year, right before coronavirus came out, I traveled to Tanzania with the Murri Center and did some outreach there. What I'm working on right now, at Murri Center as a resident is creating a global health scholar program that will be able to be spread across kind of all residencies. So we're trying our module this year, and then we'll be presenting to the kind of program directors next year, hoping to create a certificate that all ophthalmologists can have. And I'll talk more maybe in detail later in the webinar, but I think it's really important. And what I've learned a lot in residency is that you can go and do like mission work and then leave and hurt the places where you go more than you help. For example, a lot of times in ophthalmology, they think, let's go and do a lot of surgeries or go and give a lot of eyeglasses. And if you don't understand the infrastructure you're working with, you can like put the local eyeglass guy out of business, or all these people have complications and you're not there and you haven't had anyone to see them until you go back, 4 months later or whatever. So the relationships that the Murri International Center has with all these places and training them and helping them to get better, going there and working with them instead of just doing work and leaving is really important. And I'm happy to take any questions. I'm clearly passionate about global ophthalmology.
Great, thank you so much. Dr. Jackpour, would you like to give a little bit more about your experience in global surgery and background in medical school and what your involvement looks like now as a resident?
Sure. Well, I first started getting interested or particularly interested in global health in undergrad. I went to USC and they have a major in global health, which was really helpful for getting kind of some foundational ways to think about global health in general. And then in medical school, I had opportunities to do like an elective in Costa Rica at the National Children's Hospital in the ophthalmology department there, and also to do a brief trip with Unite for Sight, which is a really good organization in global ophthalmology in Ghana, where there were some community outreaches partnering with local ophthalmologists there. And so I think that in terms of in residency, I'm pretty early on so far, and then the pandemic has thrown everything off. And so I haven't had a chance yet to do anything international. That said, one thing that I really appreciate about my program is that there are a lot of international partnerships, and so it's not unidirectional where it's just we send people to other places and then we come back. It's more of a partnership, and so there's some really kind of long-lasting established relationships with partners in Brazil and other countries, and so oftentimes we have visiting ophthalmologists coming over around us, and so even without necessarily going anywhere, we still have some of that global perspective.
Excellent. So next we'd like to ask a little bit about how have you seen other residents incorporate global surgery into the residency schedule, including short-term or long-term or additional programs like pursuing an MPH during residency or master's fellowships, things like that. And what specifically about your residency program has kind of set you up to pursue those opportunities? Dr. Murri, would you like to start?
Sure. So I feel really lucky for any of you that may be applying. The Murri Center is one of the leaders in global ophthalmology. So they've always given you time basically to work during residency. So for example, every month we have 2 academic half days that are for you to work on research and other things that you're passionate about. I was able to do a week in Tanzania earlier this year, and they kind of cleared out my schedule for me because I was able to go. Your last year, you have 3 elective months where you're able to go and do international work or other types of research work. So, and that's partly because they had the integrated intern year. So because we do 4 months of ophthalmology during the first year, which is usually kind of an intern year, and it's connected to the University of Utah, it gives you kind of that back-end flexibility. That being said, you don't have to do it in international or global health. So what I've been able to do so far, like Dr. Jackpour was talking about, the pandemic made things hard, but not impossible. And the cool thing is a lot of the principles that apply to global health are a lot of opportunities right here in our backyard. So the Murri has an awesome partnership with the Navajo Nation, which is in the Four Corners area of like Utah, Arizona, New Mexico. And so that's what I've been working on right now is we've been going down there and have been helping out a lot of the Navajo Nation, and we have a lot of data that needs to be analyzed. And so I'm doing some research projects on what does the Navajo Nation present as, what is the frequency of diabetic retinopathy and cataracts and et cetera, et cetera. And then also we do surgeries down there. What kind of surgical outcomes do we have? And the faculty here is really supportive and passionate about doing this research and helping me to get set up to do that. So I think during residency, you're busy. You have busy rotations. You know how it is, like 3rd and 4th year medical school, some of these attendings of the webinar, but you do have times where you are a little bit more free. And I think the thing for me in residency that's been cool is just to balance those times. And so they're very understanding if you have a really busy rotation. And sometimes you kind of have to put things on the back burner a little bit, but then you do have these elective times, and we have these, academic half days where then I can plug in more of my time. So.
Great, and Dr. Jackpour?
Yeah, similarly, I would say we at Kellogg, we have a research block that's in the PGY3 year, so in the second year of the ophthalmology portion of residency. And it's pretty common for people to do international research experiences during that time. Oftentimes in India or in Taiwan or in other countries. It's nice that there are sort of some established partnerships already, so many people take advantage of those and go to places where people have gone before. But there's also enough flexibility that if you have a particular interest somewhere else and are able to arrange that, you can do that as well. Which I think kind of highlights the fact that I think a lot of ophthalmology residencies have structure built in to facilitate global ophthalmology work, which is awesome. And some programs might have less of that, which might make things a little more challenging, but I don't think it rules out the ability to do those things. As long as there's some flexibility built in, if you express that interest, I think a lot of ophthalmologists are interested in that sort of work. And you're probably going to be able to find someone who can help you with that. You might just need to take a little more initiative to do that.
That's great. So it sounds like both of your programs kind of have specific supports for your interests, but also, other residency programs, you can use that flexible time to pursue your interests as well. And which this leads into a little bit of another question about what kind of specific characteristics can students who are interested in global surgery use to differentiate some of the residency programs? Are there certain things you looked for and found, and certain things you found in residency programs that immediately helped you to kind of scratch those off the list in considering both your interest in ophthalmology and global surgery? Dr. Murri, would you like to start?
Yeah, that's a good question. It's always hard to evaluate residency programs, especially in kind of like a competitive field like ophthalmology. I think, like Dr. Jakpor was talking about, if you are at one of the maybe top 30 or top 40 programs, I think it would be hard to find a program that would not be as supportive of your global ophthalmology interest, because ophthalmology is so tied in with that and has been historically. I think you can look at, though, some of the things that I tried to look at is what kind of partnerships do they have, like Dr. Jakpor says, because if you are trying to reinvent the wheel and establish a new relationship with someone, that takes years, and probably not like 2 years or 3 years or 4 years that you even have in residency. You can start that, certainly, but I think looking at someone who has established relationships with people in these countries would be a good place to start. And then talking to faculty when you're there at your interview, or emailing them before and asking about their interests and what they're involved with. I think that it's important to look at sustainable things. So the stop and drop was kind of the global ophthalmology or even just global work that we did maybe 30 years ago. But education, like Dr. Jakpor said, visiting people that are coming in, that's a good sign that you're getting a good bi-directional things. What can we learn from them, as well as what can we teach them? So I think those are some things that you would look at as you're evaluating them on their websites, and then kind of in person at your interviews, etc.
Sure, and let me add in one more part to this. Do you have any specific recommendations, as this next interview cycle is likely virtual, for students to kind of pursue these, figuring out these characteristics and making sure they're part of the residency program? Dr. Murri, if you have any comments, and then we'll go over to Dr. Jakpor.
Yeah, I'll be quick because I don't want to talk too much. I was actually on the residency interview committee this year at Moran, and I agree it's a different year because everything's virtual. But I do still feel like you can connect. So showing an interest in that, asking questions about it, and then seeing what kind of things they have to offer both on their website. We tried to put out like our videos and have our website just clearly say like we're committed to these pillars. And one of our pillars, obviously, there's like the residency education, the research work, and the excellent clinical work. But one of Moran's pillars, for example, is that we are committed to global ophthalmology. And so you can look for that as you're going through programs. I think maybe it's a little bit harder when you're not there in person, but it's still pretty doable.
Great. And Dr. Jakpor, so both of these questions to you, specific characteristics and how do you figure these out during a virtual interview season?
Yeah, so I 100% echo what Dr. Murri was saying. I think it's true that it's harder or tougher in some ways with a virtual interview season, but the programs themselves are also aware of this and trying their best to communicate what is important to them as programs. And so if you see them talking about it on their website, like as a pillar, or if they have a global center of some kind, like Kellogg has an international center for ophthalmology, several other institutions have similar international centers. I think that's a really good sign because it shows that they care about it so much as an institution that they're making it a priority. Other things that can be helpful, I think, and that you might not necessarily see on the website, but trying to get a better sense of practically speaking what it looks like to get involved in global ophthalmology during residency. So asking like, what, is there a research block or international block time? When is that? Is it available to everybody, or is it like you apply and maybe you get to do it and maybe you don't? Is there funding for it? Those kinds of details can be helpful to know, and you probably would get that more by asking the residents or people on interview day than just looking at the website. And I also think, like, in general, it's helpful if you make you're interested in global surgery known, because that way people might help you make connections. So like, if you get your interview invitation, you're communicating with the program coordinator, you can say, hey, I'm really interested in global ophthalmology. Is there someone I could talk with on my interview day or connect with like at another time, and have a little more of a conversation about it?
I think
Can I
that's
add in,
oh,
can I
go
add in
ahead.
one more thing? Is that okay?
Mm-hmm.
We specifically looked for people in their applications that had mentioned or had a commitment to global surgery. So put it in your application, highlight it, make sure it's front and center. That's all.
I think that's a great point from both of you, because in previous webinars, we've heard a lot about whether or not you should make this interest known, and does it, impact the way residencies view you. But it's great to hear that, you should be forward about this, and that programs will specifically look for that as well, I guess, especially programs who are willing to support those interests. So I'd like to talk a little bit about specifically the field of ophthalmology. Are there any specific challenges to pursuing ophthalmology with global surgery, or specific benefits that your specialty has that some others don't? Dr. Jackport, do you want to start this one off?
Sure. I think that one kind of double-edged sword in ophthalmology is something that Dr. Murri alluded to earlier, which is there's the temptation for like a stop and drop. Like you can kind of think, okay, I'll do a cataract surgery, I fix someone's vision, bye, which is sort of, but also not really, because people can have complications down the road. Maybe they need additional laser procedures, and it's not uncommon to need that to have their best vision. And I think it's really important that we treat eyes everywhere like we would treat them anywhere. Like every person deserves to have good vision, right? And so it's not, I think we have to be careful not to create a double standard, which is not necessarily specific to ophthalmology only within global surgery, but it can be tempting because it's kind of a short and sweet intervention with cataract surgery, for example. I think another challenge is to not be too narrow-sighted in terms of what we think of in global ophthalmology. There's a big cataract backlog, and so it's easy to focus just on let's get these cataracts taken care of, because that can take a really long time, and it's a preventable, or it's a treatable form of blindness. But there are also a lot of other treatable or preventable forms of blindness that maybe aren't as exciting or as cataract surgery, but also need to be addressed.
Yeah, I think in your question, historically, ophthalmology has been just really committed to global outreach. And if I have to give this book recommendation now, so I don't forget, but if you look up, it's the book Second Suns, S-U-N-S. It's the story of the Himalayan Cataract Project, and it's an example of a very committed partnership between someone who is local in the Tibet Himalayan region and someone here in the United States and how they worked things out. And it's amazing the things that can be done. I can't describe the whole book, so you just have to go check it out. But anyway, just a little bit of a teaser, making very affordable, efficient cataract surgery done in the Himalayas where they need it. I think, like Dr. Jakpour alluded to, sometimes as surgeons, we're very practical and we think, okay, there's 30 million cases of cataracts and it's preventable blindness. And I know how to do cataracts. And so I'm a hammer, here's the nail. And like, let's me do cataracts, me serve people and cure blindness. And you think about it, that might work. You know, what if you have, 500 graduates in ophthalmology every year? Like when you do the math, you cannot do it. You are gonna put a little drop of food coloring in the ocean and hope to change the color of the ocean. It's not gonna happen. So what can you do? Then more creative ideas. We need to train more ophthalmologists locally, right? We need to make ophthalmology more efficient. We need to make it cheaper. We need to do all these kinds of things. And those are the big level problems I think Dr. Jakpour was talking about. And so that's the really exciting thing about ophthalmology is there are these low level interventions. Like literally when you give someone the gift of sight, a lot of times the way we sell it to these governments is that it's it's not a drain on their economy. And then these governments will buy in and say, oh yeah, we should fund an ophthalmology program because there's these blind people who people are having to work to feed. And then when we get them in the workforce, then our economy is going to go up. So you got to be creative and work in the cultures of wherever you're at. But it's super exciting and it's very doable, even if there are, small problems and big problems. So I would say it's a perfect field for global surgery.
Excellent. It's good to hear that this field is supportive of ophthalmology abroad, and it sounds kind of like it fits right in, even though there are some small challenges or big challenges that the field at least is thinking about how to approach these responsibly. So it's a little bit unlikely that everybody who wants to do global surgery and ophthalmology together is either going to go to Utah or to Michigan. So if we could take a couple of minutes and talk about either other faculty at other institutions that you know of, or other residents who are pursuing similar interests, or even other residency programs that you considered who might similarly have support systems for global surgery interests. Dr. Jakpour, would you like to start?
Sure. So in terms of some other programs that I know of as like really big on global ophthalmology, there's Wilmer, which is Johns Hopkins. They have the Dana Center for Preventive Ophthalmology. UCSF has the Proctor Foundation for International Research, and a lot of that is also globally focused. There are an increasing number of ophthalmology programs that have ophthalmology, like global ophthalmology fellowships now. And so that includes, for example, like Dean McGee has that in Oklahoma, Emory has that, Moran has that, I believe.
Yes.
Wills, Kellogg has that too, and this is not a comprehensive list, but those are just a few examples that come to mind.
Yeah, of the programs that I interviewed out off the top of my head that I remember that were committed to ophthalmology, obviously here in Michigan, Duke, Bascom Palmer, Oklahoma was a really good one. That's Dean McGee that Dr. Jakpour was talking about. California schools, UCSF and UCLA were both committed. OHSU in Oregon has a good support for ophthalmology. It's harder to think off the top of my head. Let me think. And kind of I'm trying to think regionally. In the Northwest, maybe like Mayo and Wisconsin, both had international opportunities. And I think you would be hard pressed to find somewhere that wouldn't support you. I just think, like Dr. Jakpour alluded to, when you get maybe like lower down, not that rankings matter a whole lot, but when you get maybe lower down on the list, maybe you'd have to just try to get your own funding or try and find a different mentor at one of those schools. And I think if you were, say, at a residency program, I'm not going to name one because I don't want to like badmouth any residency program, but say you were at a residency program that was not as competitive and you reached out to someone at Wilmer or Wills or Bascom or, some of these programs, or Moran or Michigan, and said to one of the mentors, I'm really passionate about global ophthalmology. I need some help making a connection. They would be more than happy to help you out. And talk to us residents if you want to as well. Sometimes the residents could be your gateway in.
Great. It's good to hear that there's so many options, and really that you could probably pursue this anywhere that you wanted to, given the flexible time and community globally in support of global ophthalmology. So I'd like to move into a couple of questions that have come from the participants through feedback forms or through the registration forms. We've got some pretty good ones here. So the first question from a participant is, what subspecialties of ophthalmology are most needed, most useful, or most able to participate in global medicine?
Who's first?
Dr. Jakpour, do you have anything on this one?
I suppose it's a really interesting question, and I think I'm gonna have to cop out a little bit, because really they're all useful. Maybe some subspecialties are a little bit more geared towards global ophthalmology, in the sense that maybe historically more and certain subspecialties have gone to do that kind of work, but I don't think that necessarily means there's not a need or an opportunity for all of the subspecialties, especially if you think about how if you're in a place with fewer ophthalmologists than are needed for that population, there's a good chance that there'll be even fewer subspecialists, and so it's like a particular type of need. I really think, like, I'd be hard pressed to come up with a subspecialty that would not be really, would not have a role in global ophthalmology. What do you think, Dr. Murri?
Yeah, so I think classically the anterior segment surgeons, like what we would talk about for maybe like glaucoma or cornea or general ophthalmology, were maybe the ones who were doing a little bit more global work. I think, like Dr. Jakpour is saying, that now it's really pretty expanded to everyone. So I think you have your pediatric ophthalmology as a huge need. You have oculoplastics that can do some wonderful things. Neuro-ophthalmology even, our neuro-ophthalmologists are connecting with physicians across the board. So I think, and then retina is a huge need right now, especially with, diabetic retinopathy kind of sweeping the globe. So like Dr. Jakpour said, I don't think that there's a certain one that would lend more than another. If you wanted to like maybe be 100 million% sure, maybe one of those anterior segment ones, but I think it's broadening basically.
I think that's in reality what everybody wants to hear, is that truly you can pursue what you're interested in and take that globally, especially as Dr. Jakpour mentioned earlier. Truly you want your care of the patient you see in front of you in Michigan or Utah to be the same as your care abroad for any patient you see. So good to hear. The next question from a participant is, I think this is asking in regards to residency applications. As a successful applicant, what is one thing you recommend doing and one thing you wish you had done differently? Dr. Jakpour, would you like to start?
Sure. One thing I recommend doing, and one thing I wish I had done differently, I guess, in the application process. So one thing that was very helpful was speaking with people who are just a year ahead of me who had applied, because there's stuff you can find on the internet, but it will be mostly just very stressful and not necessarily the most helpful. But if you speak to people you know, or the friends of friends, things like that, they can give you a little bit of those nitty-gritty details that you would like to know in terms of what is helpful for applying or the interview process, like just how things work, what letters should you have, how many of them, when to kind of have the deadlines on your radar. And especially now with the pandemic, also even changing some things about how that process works, it's helpful to have recent information from people who have just done it. And it also gives you some peace of mind to speak with someone who has been in your shoes recently. One thing I wish I had done differently, I think it would have been helpful to, it's a tough question because in retrospect, I'm like, oh, it worked out. But at the time, I do remember it was kind of a stressful and tiring process. And so maybe something I wish I had done differently would be to try to focus less on what everybody else was saying on websites, you know, and forums and things in terms of whether you're doing well or not, like try to not compare yourself to others and just focus on your own path. It's better for peace of mind.
All right, those are such good things. One thing that I'm glad that I did, just kind of in residency in general, for applications, you have kind of these different buckets. You've got, you know, surgery and service and leadership and board scores and letters and all these things that kind of go into it. And I think that talking early to your peers about how to, if you're strong maybe in service and leadership naturally, but you're weak in research and you need to, you know that you're weak in that, how to fill that up at your institution. Because you could go after a mentor and think, oh, this mentor, I got burned not in ophthalmology, but on a different subspecialty that I thought I might want to do because I was with a mentor and then we worked hard and we published this paper and he didn't put my name on the paper. And I was like, that's not cool. But he had a kind of reputation of doing that to students. And if I would have, you know, talked to more people about that, I think that would have been a good idea. So fill up your buckets with what you can do. If you're weak in a certain area, try and get that. And if you're strong in a certain area, you'll talk about that. And so, and then what to do differently. I'll do one of applicants that I've heard this year with the virtual application, just not myself, but I've heard they wish they would have applied to more programs. So in the virtual era, I would take what you would traditionally apply to and maybe add like 20 onto it because some people are not getting as many interviews as they would have in the past. So just be careful with that. You'll never wish, I think, that you had applied to less. I mean, maybe it's a little bit more money, but like if you get the interviews that you get and you are able to match, then you're gonna be really happy. I wish I would have written down notes like right after I went to the program. Some programs I did that really well with, and then some programs, like Dr. Jackber said, you're like getting tired and it's like the end of the interview season and you're like, you know, routine of like sitting down and writing stuff or putting it in the spreadsheet or whatever gets a little bit more lazy, you will forget and they blend together. So you just like be copious about it, write all your notes down, and then you'll remember who that one person you talked to and what they were talking about and why you were so into this program when you sit down to make your rank list.
That's really true, that point about taking notes afterwards. I was just looking back at my notes from the interview trail and it was actually really fun to see what I thought about different places, including the place where I ended up. So if you're not into taking notes, one other piece of advice that I heard that I haven't done myself but could be good is just leaving yourself like a voice memo where you just, you know, have like your stream of consciousness reaction to how that day went. And listening back maybe won't have all of the details of like things you would have written down in notes, but you'll be able to hear how you felt in your own voice.
That's a great idea.
Excellent tips. Thanks for sharing these. And I think a couple of things that you've said tie into this next question about opportunities for medical students to participate in global ophthalmology. So I think this kind of takes two directions. One, tying back to how both of you have really talked a lot about responsible global ophthalmology. And so how, as a medical student, kind of prior to having a lot of those skills, can you be involved? And also, as you've talked about, kind of filling up these buckets and finding mentors and things like that during medical school, and kind of even discerning how you wanted to go into ophthalmology, those sorts of questions. Dr. Murri, would you like to start?
Sure. So just kind of to get a grasp of the question is kind of how a medical student could prep for ophthalmology or even know if they wanted to do it in the global realm.
Sure. And then are there any specific opportunities to do that as a medical student?
Sure, sure. So I think connecting first with your own backyard is important. So there will be domestic. So we call it global ophthalmology. In reality, we should probably talk about ophthalmology outreach, because ophthalmology outreach is really what it is, and the patterns that we use here are the same ones that we should use, overseas, basically. So look in your own backyard, get involved with refugee populations, get involved with the homeless population, the underinsured population at your medical school. And your dean of your medical school may, be the person that you have to ask for to say, who is the, person who's in charge of all that. Once you get that, because that's like low hanging fruit, there's usually, clinics that you can volunteer in, get some skill sets. Maybe you're not going to be, super good at ophthalmology skills because it's hard to learn to use a slit lamp and it's hard to look at people's eyes, but you're going to get some bread and butter skills doing that. And you won't have to, commit a lot of time and resources to do that. Once you've done that, then you'll probably connect with the people, because the people who volunteer at those type of things, the ophthalmologists that are taking a Saturday to go help the refugee population, are the ones who are going to be also devoted to doing stuff internationally. So that's a really good way, I think, to get your foot in the door, and also to show that you are actually interested instead of just interested in like tourism, global health. Because a lot of people are like, yeah, sign me up to go to Costa Rica, and can we go scuba diving the week after? Like, which is maybe, I mean, that's not bad to enjoy the culture and contribute to the economy of wherever you're at, but you also want to, do it for the right reasons. So that's one thing. Research wise, it's tough. There are opportunities, but sometimes it takes some time and it's hard to do research like in a 3-week elective that you have. So I think if you can, to establish relationships relatively early that you can work with over time is key. And how you do that, I think, like Dr. Jockber said, talking to previous successful residents and medical students is the best way to get an idea of which places you could spend a summer with and have something that's productive that comes out. Does that answer the question? Hopefully. Okay.
I agree with everything Dr. Murri said, especially with regards to starting in your own backyard. I think that's important, and it's also a great opportunity for you to get to be more exposed to ophthalmology. In terms of specific organizations with global ophthalmology opportunities, I mentioned Unite for Sight. They have a lot of opportunities for medical students to get involved in global ophthalmology with different kinds of timeframes, which I think is very helpful, especially with juggling a medical student schedule. And some of those are research-based opportunities, and some of them are more clinical opportunities. In terms of figuring out whether you want to do ophthalmology in the first place, which I think was part of the question, for me, I liked everything. Like I liked all my rotations. I was like, maybe I should do medicine. Maybe I should do peds. Maybe I should do med peds. Like it was just all over the place because it was all good. But I think for me, some of the things that drew me to ophthalmology is the blend of medicine and surgery. So like you definitely are a surgeon. You're working with your hands. You're making things happen, but you also get to have clinic time, get to know your patients sometimes even over like a long period of time, which is pretty special. And even though it's focused on such a small part of the body, there's a lot of variety even within ophthalmology, focusing on different parts of the eye or different patient populations. Like you could do pediatric ophthalmology, for example. And I just think it's really cool to work with a part of the body that is so resonant with meaning and shapes the way people interact with the world. So 100% ophthalmology all the way. It is the best specialty, though other specialties are also good.
I love that description.
I forgot to say about why ophthalmology as well. I don't know if we're asking that later on or if I should add it in now.
Sure, go ahead.
Okay, so Dr. Jockber sold it like excellently. I think, yeah, if you want a part of the body that's affected by so many systemic things. Like you think about autoimmune conditions, you think about diabetes, you think about hypertension, you think about cancer, you think about all these types of things. It's going to be seen in the eye. Yeah, working with people, when you think about people, what do they want to do with their life? It involves vision. Even people, as they get older and less mobile, they want to like travel. They want to see their grandkids. They want to read. They want to, like all these kinds of things. It's so meaningful for them interacting with the world. So that was a huge sell for me. I loved about ophthalmology that you get these long-term relationships. I loved the flexibility that it has. So if you want to do global work, and you are so tied up in your clinic that you can't, take time, that's hard. Ophthalmology is one of the flexible specialties where you can set up a schedule where you're able to do meaningful work and you have time to do meaningful work. If you're not a huge fan of rounding, ophthalmology has a no inpatient service. So if that's a thing for you, which not that I didn't love rounding, but sometimes it got a little long with certain people. And then I really loved the physics of ophthalmology. So I did physics in undergrad, and knowing how light enters the eye and goes through and then is processed is just pretty amazing. So it's a great specialty. Quick thing, and then I'll stop talking because I know this is a long answer. But one of the advice I got from one of my really good mentors who was not an ophthalmologist when you're picking a specialty is you got to like 3 things. So one thing is you have to like the patient population. So in ophthalmology, for example, there are a fair amount of older people. If you go into peds, maybe you don't see them as much, but even then you'll do adult kind of corrections. So if you can't deal with old people, maybe don't pick ophthalmology. Kind of like the similar way, if you didn't like the homeless or maybe like opioid dependent population, EM would not be a good field for you because you don't want to hate your patients. Pick something that you like to read about. So if you like to read about the eye and eye conditions and that type of thing, you're going to be reading about it for the rest of your life. So pick a specialty that you can read about and that you like to look stuff up about. And then the third thing was, all things else being equal, pick something that has the best lifestyle. So for me, I loved trauma surgery. It was so cool, the adrenaline that I got there. But I liked ophthalmology as well or better. And I am married and have a couple kids. And so my perspective is a little bit different in thinking, yeah, could I do trauma surgery and be really fulfilled doing it? Yes. But there are other passions that I have, such as global work, such as, other hobbies and family and stuff like that. And ophthalmology definitely like does it for me, as well as trauma surgery. So, think about that when you're doing it, because you're going to do it for a long time.
And just to piggyback off of that one more time, something Dr. Murri may have mentioned earlier, which I think is also good advice, is you want to make sure you like the bread and butter of what you're doing. So, on a rotation, you might see something really cool in a specialty and you think like, wow, I would love to do this every day, but maybe they don't do that really cool thing every day, right? So you have to be okay with the bread and butter and okay with the worst parts of the job, and then also enjoy the best parts, not just enjoy the best parts, but hate the bread and butter, because then you're not going to be happy on a day-to-day basis.
And so for medical students who are still maybe new to the field of ophthalmology and then are kind of just getting familiar with what the bread and butter might be for the future, I think it's not common for all medical schools to have a specific ophthalmology rotation. So how did both of you kind of interact with the clinical ophthalmology during medical school? Dr. Murri, would you like to start?
Sure. So I was lucky enough that my program had an ophthalmology rotation. A lot of programs don't. If you don't have an ophthalmology rotation, you can reach out to neighboring institutions. And I know, for example, that there were virtual ophthalmology rotations that were done during the pandemic as well. So that's how you can kind of get mentors and stuff, because you are actually going to need, if you're applying into ophthalmology, 2 letters of recommendation from an ophthalmologist. So that's something that you'll want to think about. Bread and butter question. The bread and butter of ophthalmology for a lot of ophthalmologists is cataracts. For some ophthalmologists is a surgery called vitrectomy, where you're getting into the back part of the eye and cleaning up where the vitreous is. Sometimes there are bleeds back there, or work that you need to do with tears or detachments and stuff. And For like neuro-ophthalmology, it would probably be, you know, vision loss, you know, kind of like strokes to the eye, and some of these other things like oculoplastics, you might be doing kind of surgery around the eyelids. So I would just kind of look at that. I think it was before when I was talking to one of the moderators, I said that I loved ENT and I loved ophthalmology. And one of the things that helped me decide is that I thought cataracts were wicked cool. When I was in the operating room seeing that, I just thought it was really cool. And as starting to do, I think I've done 20 something cataract surgeries. It's really cool. Awesome surgery. You can look it up online. It's really cool. That did it for me more than ear tubes and tonsils, which are kind of the bread and butter for ENT. And that's not everyone. I mean, some people may hate cataract surgery and think this is the most boring thing in the world and love like the tonsillectomy and ear tube stuff. So that was just me.
Yeah, I don't think I really have anything to add. I agree. Like it can be tough getting exposed to ophthalmology in medical school. At my medical school, we had like 3 or 4 hours in the eye emergency room as part of our medicine rotation. And like we did have some lectures on ophthalmology, but if you really wanted more exposure, you kind of have to look for it yourself. And so I would say that if you're not sure yet, but think you might be interested, it's worth looking out for those opportunities early on just to try to get a little more exposure. Like ask a random ophthalmologist if you can shadow them, just so you can at least find out whether or not you're like, oh, eyes might be cool, or if you're like, eyes are the grossest thing I've ever seen. Because that way you don't close any doors prematurely. Oh, and then the other thing is cataract surgery is really fun. I've only done a grand total of 1 so far, but it was awesome. And I think that there's a big difference between watching and doing something. And so, you know, you might watch the cataract surgery videos and be like, okay, this is cool, but like not that cool. But it's definitely cooler when you're doing it.
That makes a lot of sense. I think that's probably true for most things, that when you get your hands in it yourself, it's more enjoyable. We've got just a couple minutes left, so I have another question here. And maybe Dr. Jackpour can start off with you for this one. Somebody is asking if an MPH is necessary to pursue global surgery. And so maybe you can talk a little bit about how you chose to pursue your master's degree and whether or not you feel like it's truly necessary to pursue global ophthalmology.
Yeah, great question. So I do not think it's necessary. I think there are a lot of people who go into global ophthalmology without an MPH or similar degree. However, I really loved my master's in epidemiology and it was such a great experience. Like I would definitely make the same choice in the future. When I decided to do it, I had not yet picked a specialty, so I didn't know I was going into ophthalmology yet. Which it was kind of funny because at the place where I did the master's in epidemiology, they had a specific global ophthalmology master's type program, and people were like, why aren't you doing that? And I was like, I didn't know. But in any case, I found it really valuable as a little bit of time to just think about things differently. You know, in medical school, you can get really into the weeds, and sometimes with things being so busy and sometimes overwhelming, you can lose track of why you're doing what you're doing. And I think sometimes having a little bit of space in an MPH year or something similar helps remind you of why you're in it in the first place and gives you a really good foundation for thinking about global health problems in the future. Again, I don't think it's necessary, but I think it can be valuable. And also, especially in ophthalmology, a lot of times people figure out they want to do it a little bit later in medical school just because you don't get that much exposure. And then maybe you're sort of in a hurry to try to figure out how to pad your resume to like prove that you want to do ophthalmology. So getting an MPH might give you a little more time for some of that ophthalmology specific experience.
Yeah, I think like Dr. Jackpour was talking about, you get a kind of a language and an education in global health through an MPH that you can't really get in any other way. do you have to do it? Obviously, like I didn't do it myself, but I think you're going to have to get that language somehow. So like right now I'm doing that global ophthalmology scholar program, and it's extra stuff that I'm doing in residency, right? So it's maybe a little bit more extra work / a little extra stress on my plate to try and get that infrastructure, because you do need to know the world in which you're working. So I think that kind of like in any field, if you want to make a real impact, you're going to have to do your homework. And an MPH would be a great way to do that. And I don't think that you have to, but if you had a passion for it and you had the thought of, like maybe Dr. Jacques was talking about, maybe you wanted to do some research also to like bone up on your ophthalmology application, that would be like a great way to do it. And then if you haven't done it and you're going straight through kind of like I'm doing, then there are ways to get kind of the verbiage and get that experience. But an MPH is a huge plus. I'm jealous of Dr. Jacques to have that. And me learning through a couple of the people who have MPHs at our institution, it's a great idea.
Great. It's nice to hear kind of both perspectives and about even future opportunities to pursue that kind of education, even past medical school. So, we're coming up into the last couple of minutes of the webinar, and we just really want to thank you both for all of the insight that you've provided, great wisdom and insight to the world of global ophthalmology. We just want to end by asking if either Dr. Jacques or Dr. Murri, anyone has kind of final thoughts that you'd like to leave the attendance with. Dr. Murri, would you like to start?
Sure. I think that my one thing that I would say, just kind of as a takeaway, is a lot of times you kind of look at the road ahead of you and the people who are into residency or who are attendings and stuff, and just kind of think, oh my gosh, like I'm just me and I don't know if I can do this. I don't know if I'll make it there. I don't know if I could make this big of an impact. And sometimes it's a little bit disheartening. But I think the key thing to realize is to lean on your mentors and to talk to them and to realize that everyone went through med school and everyone went through residency. And if it's not you, you're going to look over, it'll be someone in your class or whatever. Like it's people, ordinary people that are able to do things. So I would say, talk to your mentors, dream big, dream practically too, talk to them about, what are my chances to go into this field or that field? And if they say, yeah, I think you should go for it, and you have a trusted mentor, then don't look back and just do everything that you can. And you're going to make a big difference, and you'll be sitting in our shoes doing a webinar, and then you'll be sitting in someone else's shoes, and hopefully we'll be sitting in somewhere else's shoes making a difference for other people. So I really do think that lean on your mentors so you can dream realistically, and then dream big. That's my message to you guys.
Yeah, I guess one takeaway I would leave you with is that it never hurts to ask. So, if you need help with something, if you have ideas or questions or anything, but are hesitant to reach out to someone, just send them an email. People like to help other people a lot of the times. And so I think that a lot of medical students may not come from programs with like an ophthalmology department or like a lot of ophthalmology resources. And so that can feel like a limiting factor. And it does make things more challenging, but it doesn't have to shut off the door for you. Like if you can reach out to people at other places, and a lot of times they'll be happy to help, and it's definitely worth doing. And of course, if you have any questions for me, I'm on Twitter. You can message me at Ophthaltana, and I'd be happy to talk with you more.
Thank you both so much. For the attendants in the audience, we'll be sending out a feedback form, and we'll put in Dr. Jacque's Twitter there so you can remember that as well.
Will you put in my email as well, Kristen? If that's okay.
Of course.
My name, mike.murri@hsc.utah.edu. The HSC is like healthsciencecenter.utah.edu.
Great. So we'll have both of those included on the feedback form for anybody who's interested in reaching out. We thank you both so much for spending your afternoon with us and providing just great information. For all of the attendants, thank you for being with us. And this webinar will be posted later to the GSSA YouTube, and you can always find more at our website. So take care, everyone. Have a great rest of your evening.